So friends, welcome to our medical college and welcome to the blood bank. Now blood is a drug. It is as per the Drugs and Cosmetic Acts, comes under the category of drugs. So for drugs means they differentiate it as drugs and food items. So for all the drugs, the license is required, and there are criteria given for quality control, for the way the organization should function, what are the criteria for the staff, for the equipments that they should have, and what are the procedures that have to be followed. So this comes under the Food and Drug Administration. So now blood is collected from voluntary donors, and then while collecting the blood, we see the fitness of the donor, whether the donor is fit. Then we carry out certain tests, and if he or she is fit, then we can collect the blood. There are certain criteria. Weight should be above 45 kg, age should be 18 to 65, maximum 65 age is permissible. Then so such criteria we follow, and then we collect the blood. Now after the collection of the blood, can you bring one double bag from the empty bag? Huh? Time limit 2 minutes? 5 minutes, okay. So then we collect it and we separate it into components. So from the blood there are various components that can be made. So one is the packed RBC. Have you done blood group? Yes. So blood group, that red blood cell, we separate it and it is known as packed RBC. We add anticoagulant into it and we separate. Now packed RBC, wherever RBC is less, we give RBC. Then whatever is apart from RBC is the plasma. It will contain coagulation factors and other factors, proteins. So this is the blood bag. For every bag it is covered. It is made by sterile precautions, and for every donor there is a new needle. All precautions are taken so that donor should not have any disease. He should not contract disease in the process of blood donation. So then we separate. Now there are 3 bags in this, but we collect blood in only one bag. There is anticoagulant in that. Then we take the blood bag and centrifuge it. We separate it. So one component is RBC. Second can be platelet. If some platelet is required, you must have heard in dengue or in chemotherapy or in a severe infection, septicemia. You must have heard so many relatives requiring platelet. Anybody of you have donated blood?
No, sir, not yet.
Yes, sir. So you must have been knowing some relatives who were required to donate blood. So platelets is one important factor. Then third is the fresh frozen plasma. So the plasma, what we do, we immediately separate it and freeze it at minus 30 degrees. So if it is frozen, then the coagulation factor, now you will study everything coagulation factor in physiology. There are 13 coagulation factors, and apart from this, there are other factors also. So these factors, they are preserved at minus 40 degrees. They will not be preserved at room temperature or in where the RBC is stored at 4 to 6 degrees. So they can be stored, fresh frozen plasma can be stored for 1 year, and platelets can be stored only for 5 days, and packed RBC can be stored for 42 days. Then once these are separated, they are kept in the store. Then after that we do the testing for HIV 1 and 2, then hepatitis B, hepatitis C, malaria and VDRL. So that these are the diseases which can be transmitted from the blood. So once they are negative, then that bag can be issued. So when the patient requires blood, they send the requisition and the sample. We will do their blood group also. Then there is a process of cross matching. So if 2 individuals have same blood group, B positive, but still it may not match. बहुत जादू बोले तो जादू है. Blood is like fingerprint. Fingerprint से भी बढ़ के, fingerprint तो कभी लाइफ में 2 बार 2 जनों का मैच हो जाएगा कभी तो, पर आयरिस स्कैन नहीं होता. So वैसा है blood group. blood group we are doing ABO and RH group. This is only 2 group system. There are so many systems, 33 systems. Huh? 13. 30. Yeah, good. Now, in medical field, every 7 months, no, not even 7 months, 73 days, the knowledge is becoming double. पहले अच्छा रहता था, knowledge used to be double in 5 years, तो we were very lucky. टीचर ने कुछ बोला तो हम बोलते थे कि अभी पढ़ना है भाई. बट यहाँ तो ऐसा है कि टीचर्स may not know so many things, so you have that advantage. So yes, so we cross match and give it to the patient. So as per all the FDA rules, blood requirement is fulfilled. So we conduct the blood donation camps and give it to the patients. So any difficulty you have?
No, sir.